Thank you very much, Robert, Daniel from the Devero team, and thank you to the audience here. It's an absolute pleasure to have the opportunity to talk with all of you today. My name is Jonathan Lyons. I'm the Director of Business Development at TigerText and work very closely with the Devero team here, as well as other companies that we're integrating data with. So I have a little bit of a presentation here that'll go through the sort of value proposition and some of the challenges that we all collectively face in healthcare around collaboration. And that includes the evolution of some of the technologies that Robert mentioned, from pagers. And really what we are gearing up toward is how TigerText has looked at these problems and how we've delivered solutions, both in our existing customer base, which large health systems, and I'll talk a little bit about that, and as well with our partners like Devero, who are solving really important problems and challenges that you guys are all aware of. So happy to, again, just thank you very much for your attentiveness and then for allowing me to speak. So just to level set here, I don't want to over talk, but and sort of explain what you guys are going through, but we have a lot of clients in home health, TigerText, and working with Devero, we have asked and researched some of these challenges. And so what we're seeing here is sort of commonalities are there's across healthcare, there's an importance in improving patient outcomes, and specifically at care at home, there's a critical focus on patient well-being. But there are these burdens that we all have to overcome, whether it's maintaining staff efficiencies or, in this whole world of increasingly complicated procedures, or on the other side, these increasingly complicated reimbursement models. How are we adapting collectively to these solutions? And then frankly, there's sort of a mega trend also around the aging population in the United States. People are living longer, and this again increases some of the burden here. So the end result here is that if we're going to maintain high standards of quality, high standards of well-being, we really have to focus on productivity improvement. And this is what you guys do on a day-to-day basis, and we'll share here about how this maps to collaboration. So I want to start here with just talking about communication in healthcare from the way we think about it and understand it. And frankly, healthcare communication is broken. So a specific use case here, a home health nurse could call the doctor, but then they have to recall the doctor. They can't find them. That person's on a mobile phone. It'll start to triage through all the different areas. And so some of the specific issues that we face here that really map to collaboration or frankly, workflow issues, and collaboration is a facilitator of workflow. And so some of the challenges are there's rotating staff, there's changing staff assignments, and it's unclear who's responsible for what. The expansiveness of care has increased from personal care to readying patients for transport. These are all they create large workflow challenges. From the physician perspective, just finding the physician, they're rounding on multiple facilities. They're just hard to pin down and incredibly busy, but they're an important component here. So getting those people, getting their attention efficiently in a means that they're able to communicate back is critical. So these factors all lead to increasing complexity and frankly, lowering or decreasing efficiency of care. And all of these essentially are aligned around these challenges of communication and workflow. So let's talk a little bit about technology. I sit out here in the Silicon Valley. TigerText is headquartered in California. Santa Monica and Palo Alto are our offices. And I don't want to speak ill of some of our forebears of technology. I mean, we all stand on their shoulders, and they're all still used. So whether it's pager systems or phone lines, or fax machines, they're all still very important solutions. So from but they also have challenges, right? So for a pager, you can't really see if the message has been read. It's just not a wonderful form factor to do that, and you can't send more complicated file types like files, PDFs, or PowerPoints through a pager. And these are some of the problems we really want to drive toward and solve. For phone lines, they're just overburdened. How do I make sure somebody's sitting down at their desk to receive the call, or is there a mapping process, or am I calling the cell phone? And am I allowed to call the cell phone? Do I have the right cell phone? Those are just challenges that we see with phones. And VoIP is also a concern and costly. And the fax machines, they're ubiquitous. I think healthcare is the largest user of fax machines machines if you look at the overall industry. But they're challenging. I mean, the workflow to accomplish or to send a fax is you have to stand up, walk over to your printer fax, type in the number, print out a piece of paper, and then send it on. So this is why you're seeing solutions like eFax or TigerText allow some of these different types of workflows to be accomplished in a messaging product. And frankly, our solution coexists with these different technologies. So one of the most common use cases for an integration for TigerText is actually to take all of the pager data, map it to a TigerText user, and reroute all those pages into TigerText. So we're actually seeing the content of those pages in TigerText to start a conversation. So let me talk about sort of the last solution or technology that is ubiquitous in healthcare, and that's email. Email is a wonderful solution for some things, but not for everything. Over the last 15 years, it's overwhelmed, 20 years, it's overwhelmed the workflow or the office across the United States and the globe. And email has some very specific workflows around it. So when you send an email, generally speaking, you're thinking you'll get a response back within 24 hours. It's not a real-time communication tool. It requires you to sit down or access an app from your mobile phone and read through a long threaded stream of information. You're unable in email to see if somebody's actually read a message. So for instance, in my personal inbox, I'll be a little, I'll sort of throw open my curtain a little bit here. I've got 28 unread messages in my inbox, but if you click down and look at all of the healthcare newsletters that I subscribe to, I've got 400 unread messages that, in theory, I should be reading on a daily basis and ticking through that. And the sender of that has no idea if I'm an engaged audience member, if I've read the message. So they're just wondering, when is this person going to get back to me, or is my messaging effective? And so these are just some of the challenges of email that I wanted to point out, because I know it is used, and there's a place for all of these technologies. However, there are also other solutions. All right, so let me go to the final technology here that I wanted to talk about, which most closely approximates a lot of the things we're talking about. And so this is the basic SMS text messaging that we see on our mobile phones. And smartphones are absolutely wonderful pieces of technology, both for consumers and also specifically applied in healthcare. However, if you're using smartphones or Apple phones and your agency has a BYOD policy, or even if you're using managed devices, it creates some challenges. Consumers are accustomed to sending a message via SMS, but these types of messages are just not encrypted. There's clear guidance that we're unable to see who the sender and the recipient are and whether they're authorized users. And even some of the more sophisticated applications like WhatsApp or Facebook Messenger, they're simply not up to snuff or up to code, if you will, to deliver solutions in healthcare. And for instance, they're just not signing business associates agreements to verify that there's no leakage of EPHI. And so I guess from a technologist perspective, a bit of a challenge here, and they're accustomed to use it, and we have to figure out, how do we deliver this type of solution, but have it conform to the IT standards, the privacy standards that we're required to utilize. And this is really the story of TigerText. We started 7.5 years ago. As I mentioned, we're a California-based company, and our focus has been on secure texting and is currently on comprehensive clinical communication. So we went through this evolution of first, sort of backward engineering and a text messaging experience, but making it HIPAA compliant. And as we continue to embed into different systems and expand our ability to accomplish workflows, we sit at this comprehensive clinical collaboration solution suite that's connecting care teams with messaging and alerts and allowing for greater collaboration. In fact, if you think about us from a broader perspective where we sit in the marketplace, and I know a few of you are already using us, and thank you very much and appreciate your support, and some are using other vendors out there. We were the first vendor to go through high trust certification, which is an important certification, and happy to dig into that offline if you have questions. So where are we today at TigerText? Currently, we send 10 million messages per day, or we deliver them through recipients. We've got 99% uptime, and we're installed in 6,000 plus facilities. So we've been at this for 7.5 years, just focused on what actually seems like a narrow problem, but what we found is it has a number of really wonderful, wild use cases that map to very significant ROI. And this partnership that we're talking about with Devero is critical to that. So why is secure messaging needed in healthcare? Well, it just frankly delivers the right information at the right time to the right person. So that fundamental question I was posing in the beginning of this challenge of productivity, messaging just allows for actions and answers around communication that improve productivity. And unlike some of those other solutions out there like email, where you're sending a 17-paragraph email, it could take an hour to read, or if you're using a pager system, but you don't know if the page has actually been read, you're really able to see, hey, I can take an action on this little piece of information and deliver results with it. So one of the challenges we often face in healthcare is how do we deliver care in a secure manner? And we really focus on enterprise-grade communication solutions and work with partners like Devero, who are similarly focused on important and user-friendly user experiences, but it has an enterprise-grade component to it. So, for instance, encryption is a very important concept and part of our overall architecture. Authentication of users, maintaining solutions that meet HIPAA compliance, and just ensuring this high-trust environment that's secure. And basically, from an admin perspective, there's a lot of control that we give the facilities to add and subtract users and maintain that environment. And as I mentioned, we've been doing this at scale for a while. So some of the largest health systems in the United States, this map here is really around some of the larger health systems. They're using us. So we're deployed system-wide to physicians or nurses, allied health professionals in these various systems. And so when you're using a solution like TigerText, you can be rest assured that very large entities have kicked the tires, are using us, and have helped us to prove some of these efficiencies and workflows. So I just have a couple more slides here talking about messaging and what we're really accomplishing when we talk about this clinical communications and clinical collaboration. Messaging centralizes or replaces some of the existing solutions, really when you're thinking about that pager. So we can grab that pager data and build that into TigerText. So it starts to raise these questions of how much am I spending on pagers, how much am I spending on pager systems, and can I deliver these sorts of solutions directly to a mobile phone, either that is a bring your own device that your agency staff use, or in a managed device that you guys provision. Answering services are similar. Can we route those messages to TigerText so that you can get actionable results rather than sitting in some sort of inbox or having to make a bunch of phone calls? And specifically, which we'll show with embedding here, EHR data, so getting data from a system, transforming it, sending it via message is critical to accomplishing some of these really thoughtful workflows. And what we've been able to show is that healthcare facilities are using TigerText to do a number of very interesting things. So we become the communications infrastructure. Any messaging, not TigerText specifically, but any messaging solution really can be pointed at a number of different problems. And you can think critically about what am I trying to solve and how should I improve a process to deliver a result, whether that's lowering readmission rates or reducing a length of stay, increasing patient throughput, or just improving customer satisfaction. So I have one case study that I wanted to walk through briefly here. This is one of our clients, CHS Home Health. And basically what the challenge that they had was that they were seeing a lot of canceled patient visits just due to coordination. And some of these challenges would map to what you're seeing as well out there when you're arranging patient schedules and trying to figure out, route optimization and those sorts of things. But there are really some office staff / field clinicians were struggling to communicate around this. And the current infrastructure that they had in place was really a phone system. And so there's creating different sorts of phone tag to try to say, hey, go to this person, this patient has just canceled, and they're just on the fly essentially changing that routing. So once they installed TigerText across this office staff and the field clinicians, they were able to send a group message. And so you can send a message to one person, or you can send a message to many people in a group, similar to how you can with an email with that reply or reply all. And so now with this group message, the field clinicians, they're just able to see more patients. They're able to visit them, to care for these patients, and that patient satisfaction is going up. But from an agency perspective, it also results in increasing revenue because there's fewer canceled visits. So in this specific instance, the case study that we ran with them was that they were able to see 221 additional monthly patients, and that the revenue per patient was $89. So from an increasing revenue for this solution, they were getting about $20,000 in increased monthly revenue, or about $230,000 annually. And that's a real impact. Again, both there's a patient outcome improvement. Patients are seeing the right caregiver at the right time, but it's also efficient. So the agency is able to increase their revenue, increase their market share in their territory. So it's sort of, it's rare in business that you always get a win-win, but these sorts of solutions present a real ability to find a win-win. And as Rob mentioned at the top of the slideshow here, what is a messaging solution and how can we improve it? So the standalone messaging is absolutely valuable and critical, but the more you can tap into the existing systems that are out there, whether it's paging systems or whether it's your Devero solution, the more you're able to get out of it, essentially. And so an embedded solution, like Daniel's going to show here in a second, is really designed around specific workflows with folks like you in mind. You're able to deepen user engagement, if you think about those sorts of metrics of how do I get people to adopt a solution and create a technology environment where Devero is your home screen, essentially, for everybody out there. By embedding messaging, you're really creating a universal again, communications infrastructure that solves these very wonderful and specific use cases. So that's all the slides that I have here, and I'll turn it back over to Robert and Daniel to go forward. But before I do want to just say one more time, thank you very much for everyone for allowing me to speak today, and I hope this was helpful, and happy to stay around and answer any questions you have.
Yeah, and people can definitely submit questions through the questions pane, and we will definitely do our best to answer them. If they are with outside of the scope of this webinar, we'll definitely follow up with you through email. So we've talked a little bit about what a secure communication is, a little bit about how TigerText does it. We'll just kind of drive it home with some use cases and how you can use it as well. And Daniel will be talking about, or actually showing how it looks embedded in an EMR like Devero. So the three things you should know just about how it works is number one, you can use it through the app, the TigerText app. It'll connect to your solution that's integrated in Devero, but the communication is instant, and it remains simple and friendly, just like simple and user friendly, just like you're used to with Devero. It's HIPAA compliant, secure, and really as an add-on, it's pretty cool because it's just that. It's a low-risk add-on. You don't have to get into some 3-year or a year contract. So that's another added plus. And if we go to the next slide, I just wanted to say that before we hand it over to Daniel, it's really one-on-one messaging or even group messaging, and that's really where you're harnessing the power of this, is with the group messaging. And again, Daniel will talk a little bit about that during the use cases, but you get instant responses. You can see who's read these messages, and you get these alerts. So let's go ahead, and I'm going to make Daniel the presenter, so bear with me here as I do that. And Daniel, you should be getting a notification any moment, and you'll be in good shape to present.
Awesome. Thanks, Rob. Appreciate it, Jonathan. My name is Daniel Connors. I am an account executive here at Devero, and I get the pleasure of showing you what this awesome feature looks like built into your EMR system. So I'm going to go through 3 different use cases today. The first one I'm going to show you is scheduling a visit. So let's say that we have a referral just come in, and we need to schedule our nurse Daniel to go out there for the initial eval. Well, right here, we're looking at our patient, Tony the Tiger. We are going to go ahead and open up our messaging platform. Okay, that opens up in a new tab. Now, from this new tab, we can go ahead, and as you can see, we have our previous conversation history. But I can go ahead and click New Message, search for our nurse, Daniel, select our nurse, and then write to that nurse directly, hey, can you see patient Tony Tiger today? And that gets sent out. So you can literally get that response in a matter of seconds. A couple different use cases for this one-on-one messaging tool. You can mark this message as high priority before you send it. And so what that does, when that gets sent out, now your clinician out in the field, now they need to respond ASAP. You know, maybe this is a biller who needs to get in touch for some information before submitting a claim. Well, go ahead and mark that message as high priority so your clinician knows if they want to get paid, they need to respond as soon as possible. Another great feature is that when your clinician in the field reads the message, it comes back with a red response. And so there is no discrepancy on, you know, hey, sorry, boss, I didn't get your message. Yes, you did. I saw exactly when you read it. And that all operates in real time. So it's great for that one-on-one communication tool for scheduling a visit. You can get that visit scheduled as quickly as possible. Another functionality I'd like to show you is our group messaging feature. So you can create a group for staffing purposes. You just click Create Group at the top right. You can create a group name. Maybe you want to create a team of your nurses. You would select the members into the group. So we can select our nurse Daniel. We can select you know, a couple different nurses. And now, when you go ahead and add in all these different nurses, we create our group. And now you can send out a mass text message to all your different nurses saying who's available for a visit. A couple different use cases we're seeing for this. We are seeing mass text messages out for staffing. We're also seeing a lot of our customers break out their nurse groups into geographical locations. So, you know, team of West Side nurses or North Side nurses. However you want to manage your staffing, you can definitely do so within Devero with this Create Group functionality. So you can really expedite that staffing process. You don't have to call 5 different nurses to see who's available for a visit. You can send out this mass text message, and maybe the first one to respond back will get that visit on the schedule. Now, the third and my most favorite part of this feature is the care coordination piece. So, you know, how are you going to communicate with your team? If, let's say you have a case manager, an RN, an LVN, a PT, and an aide all involved in this patient's care. Well, what are you doing today to communicate? A lot of people use the secure emails. Some people are texting and just taking the risk of a HIPAA violation. There's a lot of not very efficient ways to do this care coordination. Well, having this Tiger Text integration built into your EMR software, it's really nice because you can create a patient-specific group, maybe our patient XYZ. You can add in all those different disciplines who are assigned to that patient's care. Now you can have a great conversation about this patient right there on your phone, how to improve outcomes, what you did on your last visit, what you're going to do on your next visit. So great part about this, let's say we have this great conversation about our patient. Okay? With one click, we can attach this whole conversation back to the chart. So we'll search for our patient, Tony the Tiger. We will save this as a chat communication note. And you can even edit this before you attach it. So let's say your team was talking about where to get dinner after work. Well, let's go ahead, let's edit that part of the conversation out, and let's just attach the patient-centric conversation back to the chart. So it's a really exciting new feature, a lot of different use cases for this. We're seeing our customers being very creative in the different ways that they're using this functionality. But it's really going to expedite that staffing process for you. It's really going to improve care coordination. And the nice part about it is what's up next for Devero is chart chat. And so you wouldn't even have to open up the messaging platform if this is going to be a patient-centric conversation with all the disciplines involved. You simply just click the chart chat icons. Everyone involved in this patient's care is automatically going to be added to the group, and then you can discuss all that patient information right there from within the chart. So you don't even have to leave the chart. You can access that information in real time without having to text, call, anything. Everything can be right there at your fingertips. So we won't take up too much of your time from the demo purposes. Rob, if you want to kind of finish up with any particular use cases, but it's a really exciting new feature, and we'd be happy to do some one-on-one demos after this if you're interested.
Sure, I'm going to go ahead and jump back and make Jonathan the presenter, and I just wanted to apologize in advance. I know that I've been getting complaints that my audio in particular when I speak is dropping in and out, and I will make my part brief here then. But I just wanted to go ahead, Jonathan, go ahead and put your put the screen back up. So just to the use cases here, I just wanted to drive this home. For those of you who are not using a communication or secure messaging solution, I just wanted to drive this home. So when you have the application open up on your desktop, you're communicating with other people who have it open as well. If the person that you're communicating with is not on the desktop or in Devero or in the TigerText desktop application, they're getting a secure text message. And what makes it secure, what's really cool, and Jonathan, you can correct me if I'm wrong here, what you're getting is a notification saying you've received a text message, they're clicking on a link, and that's where the security is embedded. Is that right, Jonathan?
Yeah, yes, absolutely. Yeah.
And so then the other piece of this, the nature of it, and I know this is a question that people have all the time, and someone did ask me, that the message has a lifespan. It doesn't reside within the solution forever. There's a setting we can adjust to determine how long it exists. But I just wanted to let you know that that's really how that piece of it works. And I'm seeing double on the screen here, but I believe it's probably my screen that's the problem. But just the care or the case, real world scenarios. We've got instant messaging, one-on-one. We're seeing people like the fact that they can see the statuses of the messages. They can send high priority messages. Daniel talked about filling shifts when there's an immediate need to fill an open shift. You can even send out a message to the entire team, and that includes a map to the patient home that they can just click on that link. I've seen Danielle from our team demo that, and it's really slick. Care coordination, like we talked about, discussing a patient case with a group, whether it's the case manager and PT or MSW, whoever is on that team, and then saving that, archiving that message to the patient chart to demonstrate history, information that's pertinent to other caregivers, and also to demonstrate collaboration. And as you mentioned, of course, you can edit those conversations in case there's anything you didn't want in the patient chart in those conversations. And then we're talking about use cases where we run into folks using this to have remote staff communicate to the back office. And you can think about the power behind this. If you want to send a document, you take a secure image photo of it with the TigerText app, send it back to the back office, and on the desktop they have it, or you can attach it to the chart in Devero. Same thing with wound photos that are remote, or any other conditions you want to report in the home to a clinical manager who might be in the back office. Those are some of the cool things that we're seeing customers use this for. Anything I missed there, Daniel?
No, that's great. One other thing that we also see is the wound photos. I don't know if you covered that, but a great part about it is how are you taking your wound photos today? We're seeing a lot of customers, unfortunately, before this integration, they were taking them directly on a device. Well, now you have to worry about that picture being stored on the device. So with the TigerText integration, you can take these wound photos. They're not stored on the device. They're stored in the cloud on the app. You don't have to worry about if that device gets lost. We can remotely wipe it, so there'll be no type of violation come your way.
I think that's a great point, and the fact that those images are not stored on the device, you know, and you know, we talk about these cool features that you see in secure messaging solutions like Tiger Text, that they've really thought through some of these things. Whereas if you're using a free off-the-shelf, you know, we just want to caution you that the Facebook messengers of the world that are out there that are designed for the consumer space, they really haven't thought through these things that you really should consider as a healthcare provider. For that, I want to jump to the next slide here and see if we have if we have any questions. And you know, folks who are external users outside of the agency, I mean, that's a good question. You know, would they be able to use that if they're working with the patient? I mean, how does a solution like Tiger Text handle that? In a case where you might have someone who's outside the agency.
Yeah, absolutely. So there's a couple different ways to do it. There's an admin provisioning process where you can add users to an organization through Devero or on your own. And so you can give them different types of roles, essentially, where they could have a subordinate user. In addition, we have a contacts organization in Tiger Text that you can send a message to anyone out there. And so in that scenario, if it's sort of a one-off situation where you're trying to send a message to somebody who's not commonly part of your group or your organization, you'd use the context organization to send that out. And in that case, they would get the message. They could actually get the message over the SMS channel or the email channel, but the content of the message is not going to be sent there. So what we're going to do, as Robert was saying, is we're going to send out a hyperlink or we'd send it to the app directly so that they could open up and the Tiger Text web browser or otherwise to read the content of the message. So we face this a lot working with some of the large health systems out there as well, where you have doctors rounding in multiple facilities that need to have access to specific staff members, and our construct to do that is basically an organization construct.
Excellent, thank you. I've just sent over a couple of links for the audience here, just to, you know, if you wanted to see more about or read more about it, we have some use cases and information about, you know, how that works on the Devero website. I think while I'm on the topic also, I just wanted to, I promised that I would put the link out there if you wanted to check out the other webinars that we do have coming up. So let's go ahead and get back to the questions. Let's see, we talk about, let's see, let me open up my question pane.
Yes. Nick asks a great question. It's probably mostly for me here about MDMs. So which ones have Tiger Text worked with? This is primarily around the managed devices, whether it's the Android ecosystem or it's the Apple ecosystem. So because of Tiger Text's nature of working with large systems like the UC system that have MDM policies, we've worked with, I think, all of the MDMs out there, and would happy to follow up, Nick, on your specific one if you have a specific MDM. But the basic mechanism to do that, there's a provisioning process where there's a little bit of code snippets that go back and forth, and we can be embedded into an MDM, whether it's a sort of a locked environment in a like a Google Play Store or something like that. So Nick, my email's after this, happy to follow up and chat with you at length around specifically how we work with MDMs. No real challenges in place with working in a managed environment. There's some use cases and functions that you have to educate around. You know, you have to find Tiger Text in that specific location, but certainly we're very well accustomed to the MDM environment.
Great, thank you. Great. I think that.
Oh, actually,
go ahead.
Yeah, let me. Nick asked a question about photos and clinical attachments. Okay, so just to drill down one more time. So native to the Tiger Text phone or the application that are deployed in the phone, if you take a photo leveraging the Tiger Text app, that photo stays in the app. It does not get saved down to the photo inbox for the phone. So everything that is within Tiger Text is encrypted and covered under our BAA, and we're not storing that information down to the phone, so we're not sending it down. It is the case that you could take a photo on the phone and then send it through Tiger Text, and your facilities would have to figure out whether you disable photos from the phone from that environment. But if you're taking a photo from the Tiger Text app itself, or you're sharing a file from the Tiger Text app itself, that is in an encrypted environment.
Excellent, thank you. Well, good. We're at the 45-minute mark, and so I'd like to do is wrap this up here. Next slide, if you wouldn't mind, Jonathan. What we have is just our contact information. I hope what your takeaway here, if you're not using a solution, a secure communication type of a solution, hope you learned a little bit about the capabilities of what it can do and help your agency overcome some of those basic communication problems and challenges that seem to hinder all agencies. Whether you decide to look at Tiger Text or another solution, or whether you look at Devero with the embedded integrated Tiger Text solution, check it out. Do a little bit of research, and I think you'll be better for it. So on that note, I'd like to encourage you to take note of the email addresses here. You can reach out to Jonathan directly, jlyons@tigertext.com. There's my email, robertl@devero.com, and Daniel is available as well there to demo a little bit more and show you a little bit about what we do. So thanks for joining us today, everybody. Our next webinar is about getting through surveys a little bit easier by documenting clinical medical necessity, and that's coming up in June with our partner PPS Plus. Jennifer Warfield will be presenting on that, and then we have SHP helping us with, they have a lot of data around hospice quality information, and we're looking to explore a little bit about the trends, how that's coming back after the new HIS 2.0 and other information regarding hospice. And these webinars are free, so please check them out. We encourage you to do that. And that's going to wrap up today. The recording will be available in the next 48 hours on the registration site, and you'll be getting an email about that. So that's going to do it for today, and thanks for joining us, everyone.